Hi, I'm Carolyn Wilson. This is my complete health assessment for Maryville University. I'm going to invite my patient in. Can you please tell me your name, age, and where you are?
My name is Kayla. I am 16. I live in Maryville Heights, Missouri.
Okay, from him speaking and telling us his name, age, and date of birth, his and where he is letting us know that he is alert and oriented, and from his speech, his speech is clear. His appearance is well groomed. From looking at his skin right now, his skin is well intact, and if he was a hospital patient, we would look at his IV site, make sure there's no phlebitis and there's no infiltration. We will also assess the IV lines and make sure that that is the right medication and whatnot. So we're going to get started. We will start with inspection. So we will start inspection. I'm going to go from the head. So I'm going to ask him to remove his glasses. Set this over here. I'm going to look at his hair. In younger people, especially on the outside facilities, you want to make sure that they do not have any lice. So you're going to look at his hair and assess his scalp. Make sure there's no tenderness. Please let me know if you have any tenderness while I'm assessing. So I'm also going to palpate his lymph nodes. While I'm palpating lymph nodes, I am also looking and inspecting his ears and his eyes, make sure all of his everything is symmetrical. Do you have any tenderness up here?
No.
His sinuses will be in here, so I'm making sure he doesn't have any tenderness there. I'm also palpating. Do you have any tenderness here?
No.
And then here will be his thyroid. I'm palpating here. And then I'm going to ask him to swallow because the thyroid will come down. And then that's also part of his cranial nerve 9 and 10 because he's swallowing, so that's intact as well. So now I'm going to pull out my pen light. First, we're going to assess while we're up here the cranial nerves. So the cranial nerve 1 is the olfactory nerve, and so we don't have any smells. But I would ask him to close his eyes, and then we would close your eyes. We would close off part of his nostril, and we would have something like coffee or peppermint and ask him to smell it, and then ask him to identify the smell. So that would be a cranial nerve 1. Cranial nerve 2 is the optic nerve, so we are going to assess his eyes. So first we're going to do the pupils and see if they are equal or reactive to light. So I'm going to ask you to just look forward. While I'm looking at this, I'm also looking at his sclera and his conjunctiva to make sure that there is no inflammation and that they're pink and moist. He has something in his eye. And then we're also assessing cranial nerves 3, 4, and 6. That is the ocular molar and the trochlear and the abducens. And that we're going to do the 6 cardinal gaze of positions of gaze. And then we're also going to test for accommodation. So look at my finger and you're going to follow my finger. Good. While we're at the eyes, I'm also going to look into his fundus, and that involves using the ophthalmoscope. And you dial and you look for the red margin and you follow it into his eye. Just look straight ahead for me. Okay. And then you would do the other eye just the same. All right, so next, speaking of olfactory, I'm going to also look into his nose. So I'm gonna have you hold your nose up. And what I'm looking for is to make sure that his septum isn't deviated and that everything is intact in his nose. And that looks okay. And then I'm also going to look in there with my pen light as well, just to look on the outside here. And he does have a little redness and just on the outside mucosa. He does have some allergies and he's been blowing his nose. Just so you guys know. And so now we're at cranial nerve 5, and that is the trigeminal nerve. And so that involves him clenching his teeth. And I'm going to hold his mandible bone. So I'm just going to have you clench your teeth. There you go. And then we're also going to test his sensation on his forehead and his cheeks and his chin. I'm going to have you close your eyes. Let me know if you feel soft, dull, or sharp.
Soft. Sharp. Dull.
Good. All right, cranial nerve 7 is his facial nerve, and so I'm gonna have you smile, show your teeth, blow out your cheeks, frown. Do you not know how to frown? Close your eyes tightly. Close your eyes tightly. Don't let me pull them up. Okay, that's good. Thank you. Cranial nerve 8 is the acoustic nerve. That involves the ears and hearing. So I am going to look into his ears. And what we want is for that tympanic membrane to be pearly gray. We don't want to see any fluid around there. Okay, and then this also involves the Weber's test. So the Weber's test is, I'm gonna put this up here on your forehead, and I want you to let me know when you do not hear any noise. Okay. All right, this also involves the Rhines test. So the Rhines test is bone to air conduction, and so the air conduction should be longer than the bone conduction. So you will usually use a timer, so the air conduction should be longer than bone. Let me know when you do not hear it.
All right. Okay.
All right. You would do the other ear just the same. All right. So cranial nerves 9 and 10 is the glossopharyngeal and the vagus nerve, and that involves the gag reflex and swallowing. So I'm gonna have you open your mouth, stick out your tongue, say ah, and you ah. And you want to look for that uvula to go up and down. And then he swallowed, so that's not a problem. But if they didn't swallow, then you will want to test for that gag reflex. And there you go. Nasty, huh? All right, so then the 11th cranial nerve is the spinal accessory nerve. And so you want to test for their strength in their spinal column. And so I want you to go against my hand over here. Turn your head. There you go. Do it again. And then you also want to do the shoulder shrug. Pull your shoulders up. There you go. Thank you so much. And then the 12th cranial nerve is the hypoglossal nerve, and that just involves him sticking out his tongue. And just, we want to just assess for make sure his tongue is midline and it does not mediate to the left or the right. But then we also want him to go to the left and the right. Switch your tongue to the left and the right, and then lift your tongue up. And then you want to assess each side of the tongue, okay? Because if there are any tumors or whatever that is cancerous in the tongue, it will be under or on the side of the tongue. So we do not see anything in there. And his mucosa, his mouth, while we're in here assessing, is pink and moist, and so we're not concerned about anything in there, okay? Alrighty, so moving along. So that is pretty much the part of the head, ear, nose, and throat assessment. It all involves the cranial nerves as well. So we're gonna move to the listening part, which involves the chest. But we're going to go back to the head because this involves some pulses. So we can palpate the temporal pulses, which are right here. Okay. And then we can also listen with the bill of our stethoscope. And then you have your carotid pulses here. You also want to assess for any jugular vein distension, which he does not have, because that would be significant of any fluid collection around the heart, which he does not have. So you want to assess that. You want to palpate. You do not want to palpate both at the same time, because that would occlude any blood flow to the heart or brain. So, and you don't want to press hard either as well. So. And then you will listen with the bill of your stethoscope as well. You also want to have them take a deep breath and hold it. Okay, breathe. Take another deep breath and hold it. All right. You're listening for any bruits because you don't want the respiratory, you don't want his lung sounds to interfere with you listening to the bruits. All right, so next is the chest. And then you want to look at the chest. You want to make sure that you do not see any this is the inspection of the chest. You want to make sure you don't see any open wounds, any bruising or anything like that. You want to look at his respiratory rate, how he's breathing. He's not using any accessory muscles to breathe, so that's good. And then you want to palpate the chest. And so we're not palpating any subacute emphysema. And then we can check for tactile firmitis, where we will have them check for the vibrations and make sure that they are simultaneous. And so, say 99.
99, 99, 99, 99, 99, 99.
Okay, so it should be the same on each side. If not, then that means there is some consolidation on either side. And so next you would percuss. It's kind of difficult to percuss for a female than it is for a male on the interior side of the chest because they have more breast tissue, but it's possible, but it'll be a little harder. So you're just percussing to see where that lung border is. And then over here, you'll hear a lot more dullness in this area because this is where the heart sits. As you can hear the difference, because the heart is like a fist in the middle right here. As you can hear that. Okay. Also, you want to check the point of PMI, and so it'll be at the mid-clavicular line and probably the fifth mid the fifth intercostal space. And then this is where you can feel the apical pulse. And I feel his pulse, but if you could not feel the person's pulse, you would have them lay laterally, left lateral, and then have them raise their hand, and you can probably feel it that way the best. So now I'm going to listen to his heart tones. First, you will listen with the diaphragm of the stethoscope. So you have the aortic, you have the pulmonic, you have the Erb's point, you have the tricuspid, and then you have the mitral. And then you will go back and listen to the same points with your bell. And you're listening for sounds like S1, S2, S3, S4, and if they're having any heart murmurs or gallops and whatnot. Okay, so next we're going to move to the lungs. And so there are 6 points at the lungs that you will listen to on the anterior portion of the chest. Take deep breaths. In and out. Okay, good job. Now we're going to go to the posterior of the chest. I'm just going to have you get up and turn around. Okay. So same on the posterior portion of the chest. You will inspect the, did it stop?
No, the light just came off.
You will have it, you will inspect the back portion of the chest, and then you will palpate the same. And then percussion is a little different because you have the scapula. So you wouldn't percuss over the scapula because you wouldn't really feel anything, but you're going to percuss here. I'm going to have you turn around a little more. So we're going to check the diaphragmatic excursion. Turn a little more. Sit up. And then we can percuss down. Take a deep breath. And I'm checking for where I don't hear the resonance. Do it again. Okay, so that was about here. Okay, so then we're going to do it again, and we're going to go down again. Take another deep breath. So that was about here. So from here to here is where the diaphragm expands. Okay, so it should be from anywhere from 3 to 6 centimeters, and so that's the diaphragmatic excursion. So next, we have what we call lung expansion. So you will take from about the 10th rib, and you will hold your thumbs in the middle of the spinal column around the person's chest as much as you can, and then you will have them take a deep breath. And as you see, my thumbs went up at the same time, and that's what's supposed to happen. You do not want your thumbs to go up, one thumb to go up more than the other one, because that's not good. All right. So now we can check his lung sounds back here. And I'm going to do the ladder effect. So take some deep breaths. Okay, good. His lung sounds were clear. No crackles, no evidentious sounds were in the posterior or the anterior. So he's good on his lung sounds. I'm gonna have you lift this up. Turn around. We're now gonna check his pulses. You can check radial pulse. You can check a brachial pulse. You can also check a popliteal pulse. You can put your fingers in between and come out until you feel it. And then you can also check a pedal pulse. And a DT pulse. While you're down here on his legs, you also can check for warmth, edema. You can see the hair distribution. Hair is good, a good sign to show that it's good circulation, especially on the toes. Look for any discoloration. You can also check his reflexes. That was his brachial. You can check his bicep. You can check his tricep. Then you can check his radial. You can check his popliteal. And then you can check his Achilles. And then he should have a plantar effect with that. And then you can also check a Babinski. On babies, their toes will spread. That's normal. On adults, that should not happen. You also check the other side as well. I'm going to have you lay down. So now we're at the abdominal portion. As you can see, his abdominal muscles are really muscular. So for a person that has really good abdominal muscles, you would have them kind of bend their knees just slightly. And so first you would inspect, then you would percuss, and then you would palpate. Auscultate, then palpate. So we're going to inspect. There is no incisions. Doesn't look like he has any open wounds or sores or anything. So now we're going to auscultate. I'm going to go from the path of the large intestine. So that will be the right lower quadrant. Right upper quadrant. Left upper quadrant. Then left lower quadrant. If you suspect that you do not hear any bowel sounds, hypo, or do not hear any, you will listen for a full 5 minutes. Now we're going to listen to the aortic artery. The renal arteries. The inguinal. Then you would also listen to the femoral, but he has his clothes on. You can also palpate the femoral arteries as well. And then you would also be able to palpate the aortic arteries. You would hold this. You would hold your fingers on both sides here. And you can kind of palpate the aortic artery there. Okay, so now you would do light palpation. Do you have any tenderness?
No, ma'am.
I'm going to percuss and see where the border of that liver is. So that's my first marking. And I'm going to go up. And that's where it changes. And then over here is where your spleen is. So it changes right in here. So it measures about 6. And so you will palpate. Have him take a deep breath. And then you can probably feel up in there. He's very muscular, so. Also palpate where this spleen is a little. Take a deep breath. Okay, so that's pretty much the abdominal assessment there. I'm gonna have you sit up, have you stand up, turn around. You can also check for CVA tenderness, and that's where you would put your hand here and then you would just pound his back. I can't really hold this and do that. You put your hand here and hold his back and just tap. Does that hurt? Does that hurt?
No.
Okay. And then I'm have you sit down. Have you put your hand out. We're testing for coordination. Put your hand here and just flip it back. Good. And then put your hand here and just go back and forth. Now touch my hand and keep going to your nose. Good. Now have you stand up. Close your eyes or put your hands out. Close your eyes. This is the Runberg's test. And you're trying to make sure that they don't sway and they have good coordination. All right, that's good. Now I'm just going to have you walk forward on your toes and come back on your heels. Good, come back. Good job. That shows that he has good coordination and that his cerebellum is intact. You can have a seat. The last thing that we're going to do is we're going to just test his vision. I'm going to have you read this third line.
CFTE.
Can you read the line under there?
ZTFDI.
Okay. Cover up your left eye. Can you read the third line?
NPD. CFTZ. LOPD. E. TFLCZ.
Okay. So his right eye is 20/50 and his his right eye is 20/40 and his left eye is 20/50. All right. So that concludes our complete health assessment. And hope you enjoyed.